everything okay? I haven't seen you in a while. You haven't been in your garden. Is everything okay? Because I'm hearing you crying and swearing, and I hear the poor baby.
All he does is want
crying.
to eat, sleep, and poop, so I never get to go outside and do anything.
When was the last time that you got dressed? You know it's 5 o'clock in the afternoon in this house.
I'm not going anywhere.
But he's crying. He needs you.
I just fed him. He's fine.
How long have you been feeling this way?
Since he was born, see, he never shuts up.
I think it's probably about time that you go and you see a professional.
What are they gonna do?
Well, they can help you try to get through what you're feeling right now after the birth of your baby.
But I don't want them to think I'm a bad mother. I don't want people to know.
Well, it's confidential when you go in to see the doctor, so no one will know. Just me.
Will you keep Henry?
I will keep the little precious baby while you go and see the doctor.
All right, I'll call to make an appointment.
Okay. I think that's a good idea.
Hello, Jen. How are you?
Okay.
I'm Nurse Jackie. So how are you feeling today?
Depressed.
Depressed, really? Where are you depressed?
My baby is annoying.
Okay. Well, we're gonna figure something out for you today, okay? I'm just gonna take your vital signs, so just place your baby on the side right here. Place him. Okay, let me see your arm.
Doesn't shut up. He cries all the time.
Okay, ma'am, that's not really necessary to be doing your baby like that. Take a deep breath. Okay, I'm just gonna listen to your heart. Okay, sounds normal. Okay, everything looks good. Let's just take these off. So I'm just going to ask you a couple of questions, okay? And this is for Dr. Carolina to review with you afterwards. So are you okay? Okay. Are you sleeping okay when your baby sleeps?
My baby never sleeps.
Okay.
He's so annoying.
Okay. Any changes in your appetite?
I hardly get a chance to eat.
Okay. Are you afraid of any thoughts you might be having?
I feel like I want to smother him because he doesn't shut up.
Is there anything that you want to tell me that you're afraid to?
No, just sometimes I feel like I want to kill my baby. I don't feel like.
So it's just
a
really
mom.
bad, scary thoughts then?
Yes.
Okay. Okay, well, I'm going to give these questions and answers to Dr. Carolina, and then she'll be in to see you shortly, okay?
Okay.
And find something to help you.
Okay.
Okay, I'll be back. Sorry, I forgot to turn it off.
Ah!
Hi, Nurse Jackie. So,
Hi, Dr. Carolina.
Who's next?
You have a patient here in 14B. She has a 2-month-old baby. Serious issues today. She states that she wants to like smother her baby, drown it, do all these horrific things to it. And these are the questions that she answered with the that she answered, and yeah, she needs some serious help today.
Shut up already.
You see what I'm talking about? It's crazy today.
I'll take it from here. Hi, Jen.
Hi.
Dr. Carolina. So what brings you here today?
My neighbor thinks I have the baby blues because my husband died while I was pregnant, and I just don't feel like I want to take care of the baby.
Okay. So I'm looking over the questions and answers that Nurse Jackie did for me. And I see that you've been feeling this way for 2 months now since you had your baby.
Yes.
Okay. It's actually not the baby blues because it's already been longer than 2 weeks and you've been going through this for 2 months. So you feel like you feel like harming yourself with the baby?
Sometimes.
Okay.
He cries a lot. It drives me crazy. I don't know what to do.
Okay, so postpartum depression, do you have any symptoms of mood swings, anxiety, depression? You lose interest in things you used to like doing,
Yeah.
insomnia.
I haven't slept, but it's because he's crying all the time.
Do you feel unable to love your baby?
I don't feel like I love my baby like I should. It's very depressing. I should be
Okay.
happy.
So you feel sad and
Yes.
depressed? Okay. So yeah, I would say you have postpartum depression. It's very common with women who have babies, but not every woman experiences this depression. But I just want you to know that it's a non-hormonal influence, such as psychosocial because of poor social influences, and there's also it's a psychiatric illness that also contributes to it for some people, like in past anxiety and issues, several other factors such as personality disorders and sleep deprivation and pregnancy and birth complications.
Okay.
Do you have any allergies?
Not that I know of.
Okay. Are you currently breastfeeding?
Sometimes, but he wants to eat like all the time, and I don't want to do that. So.
Okay, so since you are breastfeeding sometimes, I'm going to go ahead and prescribe you Prozac. It's an antidepressant. And you're going to feel that the baby's going to be a little bit drowsy once you start taking the medication. And I'm going to go ahead and give you 10 milligrams per day. You're not going to feel the effects of the antidepressant until after about 4 weeks or so because it works very slowly.
Okay.
You are going to you might experience some headaches, drowsiness, insomnia, but not everybody experiences those side effects, okay?
Okay. What should I do if they get severe?
Okay, if they get severe, if you just don't like the way it works on you, you can go ahead and come back and call me, and I'll try another medication.
Okay.
I'm going to go ahead and refer you to Counselor Desiree.
Okay.
You can start therapy with her, so you can start bonding with your baby and talk about how you're feeling, and maybe they can have some group counseling with other moms that have been experiencing the same symptoms as you, and together with the medication and counseling, you should be able to get back to normal how you used to be before having your baby.
Okay. Thank you.
So I hope you come back for a follow-up in after 4 weeks, so I can see how the medication is working on you. And if you just don't like the way you're feeling with the med, you can come back before that.
Okay. Thank you.
Okay, thank you.
I'm Counselor Desiree. Your doctor, Carolina, referred you to me. I understand you've been dealing with postpartum depression.
Yes.
Okay, and how long have you been dealing with that?
Since it was born about 2 months ago.
Okay, so your baby was born 2 months ago. Okay, I want you to understand that 10 to 15% of mothers experience PPD, and it is normal to feel this way. Do you have support at home or any help with the baby?
I have a neighbor.
You have a neighbor. Is your neighbor willing to help you when you need it, or?
Yeah, I think so.
Okay, because the one thing that we don't want is for you to ever harm your baby because you're feeling depressed. So if you are feeling like that, it would be good to call up your neighbor or any family that you may have to help you with your baby. So I see that Dr. Carolina prescribed you Prozac. That's an antidepressant. Prozac is okay to use with breastfeeding, so it won't harm your baby. The only thing that it may cause is infant sedation. So no, it's not bad. It may just make your baby a little bit tired.
Good. Maybe he'll sleep then. He cries all the time.
Medication.
If it does cause your baby to be sedated, just make sure that your neighbor or family is around to help you if you are depressed. Another thing besides medication that is very important is therapy. It's very important to express how you're feeling, not keep it in, and that's where I come in. You can go talk to me, or even if you have family or anyone that you're close to, it's great to get out your feelings, okay? And it's also very important to bond with the baby. So I would advise you to take Mommy and Me classes to help you bond with the baby and hopefully get rid of that depression that you've been dealing with. Okay?
Do I need to come back and see you?
Yes, you do need to come back and see me. We can see how you've been progressing. Hi, Jen. Wow, you look so much better than you did 3 months ago.
Thank you.
How
I feel
have you
better.
been? You look better.
Much better.
Okay. I see you've been going to therapy every week
Yes.
as scheduled. That's
Group
great.
therapy.
How do you feel?
Much better. It's nice to see other moms experiencing the same feelings.
Yeah, that's great. I see. And how's the medication been working out?
Carolina discontinued it because I was feeling better, and it seems to be okay.
Okay, and so you feel okay coming off of it?
Yes.
All right. What about those Mommy and Me classes? Have you been?
I joined a local moms group, and we get together with children about the same age, and so I have more resources for babysitting or babies for Henry to play with.
That's great. So I am going to cut down on your therapy sessions. You don't have to go every week. I see you're doing much better, so if you want to go once every month, that should be okay. And as long as you just come and check up with me every couple months, it looks like you're on the right track.
Okay.
All right.
Thank you.
Hey, Jen. My name is Jackie. I go by Nurse Jackie here. How are you doing today? You messed me.
The side effects, you're gonna feel drowsy, headaches sometimes, and insomnia. Isn't that
I already don't sleep. You're giving me something that makes me not sleep more.
I don't have an answer for that, so let's just video. Like,
Okay, don't say that.
since you've been having these symptoms longer than 2 weeks, because the baby's already 2 months, I'm saying it's postpartum depression.
Keep going, because you're just testing. We'll tape it again.
Okay. Have you ever heard of postpartum depression?
Yes, but isn't that for crazy people?
No. It's
Stop it.
Prozac. That one's okay to be able to breastfeed your baby. You're just gonna feel that your baby.
Damn it, we were doing so good.
And I'm also gonna refer you to a very good counselor, and her name is Counselor Desiree.
Okay.
You were doing so good.
Talking about Desiree.
Is that her name? Did she say
Ew.
Counselor Desiree?
Yeah.
Stop.
Keep going, because you guys are going to have to cut that.
Focus, okay.
Hi, Jen.
Okay. Ugh.
Stop.
Don't laugh.
Okay.
I can see Jackie's hair.
Take the damn wig off.
And antidepressant is okay to help with, is okay. The antidepressant is okay. Ew, what am I saying? It's okay to use while breastfeeding, okay?